After the Omicron COVID variant swept through the county last winter, many thought that COVID was now just a very painful memory. But unfortunately, just like the horror movie villains, it keeps coming back from the dead. You know, Mike, the first Jaws movie was scary and fun, but by the time the Sharknado 5 was released, the genre had run its course. Now there's been an uptick in new COVID cases. So what should be the appropriate response for the county for this disease that seems to have no end?
Well, it's really interesting. The challenge we have is that at least Sharknado we could turn off or choose not to watch. This one just keeps showing up whether we want to or not. I think people are starting to get in a really challenging situation as far as creating a whether you want to call it a mandate or a guidance that says people should be masking. The thing I've noticed, which has been interesting, so we just completed Montgomery College graduation today, was the number of people who are just taking it upon themselves. Really, people, if they're in a situation that they feel they're compromised, or they feel that just because there are a lot of people in a single place are wearing masks. And I think that is a gratifying thing to see. We just traveled last week to another graduation, and again, a number of people were masking, were self-selecting to do that. And I think that you're seeing more and more people recognizing the number of folks that they know that have been exposed and are catching, contracting COVID, who are taking it upon themselves to set it up for themselves, a way to make themselves safer. And I think that's a good thing, because I don't think that for the county to say, okay, we're going to mask up again, that you're going to get much receptivity, unfortunately.
Well, we're going to deal with that part of it later on in the segment, but I think it's wonderful to hear that the population or the populace has made their own decision and choices regarding masks or not to mask, and that there's a level of tolerance whether you choose to mask or not to mask. So I think that's tremendous. I hope our elected leaders also hear that. And it worries me, Laurie, because, while the case numbers are approaching the moderate levels that have been established by the county executive, the hospitalization rate is very low. In fact, the average number of hospital beds in the county being utilized by COVID patients for the last 7 days is less than the 10% of capacity. So should the county just, take a chill and be cautious before it reinstitutes any more mask mandates?
Casey, I think you asked me the same question months ago in the very big uptick that we had. And it was, the hospitalization rate was low at the time, and it did go up some, of course, but it wasn't as bad as the first time. I think, I don't think we need to institute a mask mandate now. People need to continue with this nice break that we've had and continue. I don't think we should bring back the mask mandate. I think that they're pointing to the CDC studies that are listed, or there's studies listed on the CDC website. And I've seen other articles, such as from the Atlantic, which refutes a lot of the information that's in some of these studies, that there's a lot of flaws in those studies. So I don't know if we can necessarily rely on the studies that we read when we look at the CDC website. Cases went up even when we had the mask mandate. They're going to go up anyway, and then they're going to go down anyway, regardless. There was another study that recently was published that said where they had 895 school districts that were tested, and there were COVID incidents, or when COVID incidents, that the districts where there were no mandates to not have school, or I'm sorry, I need to go back again. when there was virtual versus where there was in person, there was no statistical difference in the number of COVID incidents. So I think that's a very important study to see that we needed to have our kids back in school, and they should be in school in a natural way where you can see someone's face. And you look at other, World Health Organization does not recommend masks for children under 6. So, there's just a lot of information out there. We need to
but there's still a lot of pressure to, especially when you look at the schools. Mike, I'm going to pivot for a second, because, it seems that, MCPS is trying to balance itself on this, but I've heard reports that it's almost being done on a school by school basis, that the principal is actually the one making the decision. Is that the right way to go?
It actually might be. I mean, because what you're seeing is you're having schools that are seeing incidences. You're seeing schools that are seeing having fewer incidents. I've seen some schools where they've had 30 and 40% of their population that are having COVID or staying home, and you got others where you're not seeing it. And so rather than trying to come up with a blanket mandate and trying to figure out how this is going to work across 205 different schools in Montgomery County, let people on the ground be able to make those decisions as they see the situation unfolding in front of them. And I think that it's important for us to recognize that, unlike where we were 2 years ago, where the only thing we had was to try and mask and avoid each other, we have vaccines, we have people, we have boosters, we have a variety of things at our disposal in ways that we didn't before. And so it's not a, kind of single thing that we do. It's going to be a variety of things, and people need to continue to focus on making sure they're availing themselves of the vaccines that are there, being cautious in the situations that they're in, and then recognizing what's happening on the ground where they happen to be and react accordingly. And so I think we know a lot. Let's learn. Let's take advantage of what we've learned.
Well, I'm going to follow up with you, Mike, because we're running out of time in this segment. But would be the political fallout if the county executive council reinstituted an indoor mask mandate before the primary?
Oh, I think it'd be a challenge, although, you haven't had the backlash here in Montgomery County that we've seen other places. I think there would be frustration, but I continue to be intrigued, and impressed probably isn't the right word, but fascinated by how we in Montgomery County have tended to be more circumspect than other communities I've read about or seen, where people are okay. I don't think that we're excited about a mask mandate, but if the numbers are such that are out there, I think you wouldn't have the backlash you would see other places. And so I don't think you'd see as much in the poll as you'd expect.